Welcome back. It's still Sunrise on Channels Television, and we are talking about health now. The federal government has launched Project 10 million, and this has to do with hypertension and diabetes, trying to ensure that Nigerians know about their status and also to control whatever condition that they are dealing with in terms of the two non-communicable diseases. To tell us more about this initiative, we have joining us in our Abuja studio a Mandate Secretary, Health Services and Environment Secretariat of the Federal Capital Territory, Dr. Dolapo Fashawe. Good to see you, Doctor.
Hello, Yomi. Hello, Auntie Alero.
Good to see you. Okay,
we missed you in Lagos.
Okay, Doctor, let's start with, by you telling us what the burden is in terms of hypertension and diabetes in Nigeria that necessitated this, Project 10 million.
Thank you very much. First, the Project 10 million is aimed at checking the blood pressure of 10 million Nigerians. And this came about because we find out that non-communicable diseases like hypertension and diabetes is fast on the rise. Not only on the rise, we find out that people are dropping dead of complications of hypertension and diabetes, especially hypertension, not diagnosed hypertension. And the strangest thing is we find people with healthy lifestyles, exercise buffs, just having a heart attack. At autopsy, we find signs of undiagnosed heart disease, which is secondary to hypertension. Now, a study about in 1990 showed that just 8.2% of Nigerians were living with hypertension. Jump fast to a World Health Organization study. In 2020, this figure has risen to 32.9% of Nigerians. Now, if we look at the total population of Nigeria, we would see that for documents purposes and for research purposes, we have about over 10% of Nigerians living with hypertension, 11.2%. This is over 28 million Nigerians living with hypertension right now.
Ouch. That's a huge number, and, it's something that we shouldn't let just lie like that. It's something to take care of. So how do you intend to measure or check this blood pressure of the 10 million Nigerians that you talked about?
So this is a sub-national program. All commissioners of health in the 36 states of Nigeria plus the FCT are out from October 28 to November 10 in strategic places taking blood pressures and blood sugars. Blood pressure indicates if you're hypertensive or not. Blood sugar indicates if you're diabetic or not. You ask me, how do we intend to carry out this exercise? It has been found that health-seeking habits and even our social, cultural, and social economic situation makes it difficult for people to go to their nearest primary health care center, where this is done for free anyway, or to their healthcare provider to check their blood pressures and sugars. So what we have done this time is to take health care to people where they live, where they work, where they play. We are going to have stands, for example, in Abuja, in all the 6 area councils of Abuja, Amak, Abaji, Kwali, Gwagalada, Kuje, what's the other one? Kwali, Gwagalada, Kuje, and all the 6 of them are going to have spots in the area councils, in the traditional leaders' homes, in the markets, in the churches, in the mosques, in the farms, even in hard-to-reach areas. So we are saying we have brought this to you. And we are not only checking your numbers, we are providing opportunity for free treatment for the first 1 to 3 weeks of diagnosis. And after then, we have all collectively decided to use this opportunity to increase uptake and enrollment into the health insurance scheme, either national or state. For FCT, the Honorable Minister of the FCT has been magnanimous enough to say that all pregnant women, irrespective of your age or cultural or political or religious affiliation, should be registered on the health insurance scheme for free. And also, there's a group called the vulnerable people. If you are poor, you cannot afford health care, you would rather use the money for medication to buy food or pay your children's school fees, we register you on the health insurance scheme for free. This is to ensure sustainability and not just make this program another parade or another political jamboree. We are hoping that at the end of this, we will be able to improve the indices and reduce the prevalence that I measured just now of hypertension in the whole country as a whole.
Now, Doctor, you said that this was launched on the 28th of October. Has there been enough awareness so that people are actually ready, so that when the doctors, nurses, or whoever are coming to take the numbers, the people are aware and are willing and ready to let them?
So, in primary health care, we focus on health promotion. Health promotion means prevention is better than cure. And how do we get this message out? We have used unconventional methods this time.
Okay.
Apart from social media, old and new media, we have used the communities, we have used the community leaders, we have used the traditional leaders, we have used town criers, we have used market women. Long before October 28th, there has been advocacy programs going on in the FCT talking about this program. And luckily for us in Nigeria, this program is backed by the Nigerian Governors Forum. So at every opportunity where a governor of a state has to address his citizens, we talk about this upcoming program, and we encourage everyone to take advantage of it. Like I'm here now, I am saying that in Abuja, we would have almost 200 test centers. In all the MDAs in this city, there will be a test center. Just simply downstairs in your Potter's Lodge, know your numbers. Even for those that have normal numbers, we teach them how to control and keep their numbers normal. For those that have abnormal numbers, we not only go ahead and give medication just straight away. They are referred. We are even using telemedicine this time. You can talk to a doctor right there on the spot. And the program spans over days because you can't make diagnosis at one check. So we say, okay, go to your office and come back this time tomorrow. Come back in 2 days' time. Make sure you have a good sleep. We have included sustainability and monitoring and ensuring that we follow up these patients to the last port of call. The last port of call is the general hospitals. At these screening centers, there will not be prescriptions. We will not give medications because it is also easy to get excitable and start to treat someone who has had a long day or has just had a full bottle of Coke with a randomly high blood sugar with medication. No, this has been thought through. We have done a lot of advocacy. We have done a lot of sensitization. And from what we have seen in my states, this territory, FCT, so far, people have been very responsive.
Okay. Today is the day 5 of the exercise. How have the people received this? And what kind of numbers have you discovered? Are they alarming? Or are they the kind of numbers that will give a doctor like yourself a good sleep?
Unfortunately, studies have shown that the prevalence of hypertension in Nigeria is highest in the north central zone, where we are, and in the south-south. For diabetes, it is high in the south-south. Now, we have been seeing alarmingly high figures. And the most heartbreaking part of this is that 65% even of educated people in the secretariat did not know that they had high blood pressure. And for me, this is a mark of success. Even though it's alarmingly high, but we are able to catch hypertension early. I need to say that hypertension is a very treatable disease. You can live with hypertension and have a productive lifestyle. You only need to adhere to your doctor's prescription, change your lifestyle, and take your medication. So far, what we are finding out in FCT is that a lot of people are living with otherwise undiagnosed hypertension. Hypertension is called the silent killer because at times in the early stages, it shows no sign or symptom. You are just okay. And that's why we hear, oh, he was fine, he just visited someone and slumped on his way home. And in autopsy, we find out that this person has been living with hypertension. The success of this program stems from being able to pick up new cases, educate them, know your numbers, and being able to control your numbers.
Okay, Doctor. So we'll still get back to some of the other things that the FCT is doing, and largely the 36 state commissioners of health. But let's talk about the predisposing factors for hypertension and diabetes, so that sometimes some of these things can be prevented, even though we know that some people would inherit, the condition from their parents.
Thank you very much for that question. I was somewhere on a TV show like this where somebody said, what you don't know doesn't kill you. Why are you checking this? I am here saying publicly that what you don't know can kill you, especially when it comes to hypertension and diabetes. A lot of people attribute hypertension to, stressful life. I am not stressed. I don't let things bother me. This is fallacy. Predisposing factors include your lifestyle, your diet, high salt diets, sedentary lifestyle, family history. You can inherit hypertension and diabetes, smoking, excessive alcohol consumption, the way you treat your body, your body will respond back. High blood pressure simply is when your heart is pumping more blood to ensure that it sustains your lifestyle. For diabetes, it's strict. Diabetes is defined as an increase in blood sugar in your body. There's type 1 diabetes and type 2 diabetes. Type 2 is the most common form of diabetes, accounting for 90 to 95% of diabetes sufferers. And what happens is your body is not able to process the amount of sugar you take in, which turns to glucose in your body. So first, excessive sugar intake, excessive alcohol consumption, family history, other predisposing factors. When you have a problem with an organ called your pancreas, it means you are not able to produce enough insulin to take care of your carbohydrate intake, your sugar intake. By the way, it's not only sugar. Our diets, excessive carbohydrates that is not being processed into the right type of sugar for our bodies to excrete it can lead to diabetes. So I've seen people say, oh, I don't take sweet things, I don't take sugar, but check your numbers. Diabetes used to be a disease of urbanization, of the elites. Hypertension too. Right now, even of age is also a predisposing factor. But we are seeing that when we do age adjustment statistics and checks, the graph is skewing lower. From over age 50, we are seeing teenagers with hypertension. We are seeing people in their 20s and 30s with hypertension. So the predisposing factors are numerous, but if you have a family history, please check your numbers. If you have any symptoms like headaches, fatigue, difficulty in breathing, check your numbers. But health promotion is what we say we are doing. Prevention is better than cure. For all of us listening to me here, take advantage of this program. If you do not want to go to any of our centers, go to your primary health care provider and check your numbers. Even the socioeconomic status of anywhere, not just Nigeria, stress, difficulty in moving around, in living an otherwise normal life can predispose you to high blood pressure. So it's lifestyle, urbanization. We're now starting to eat foods that we didn't otherwise eat and we cannot process appropriately. We see that in developed countries, children are brought up with eating vegetables and greens, and their parents emphasize you have to take your fruits and all. We are brought up with eating meats. The affluent eat a lot of meat. This is also a predisposing factor to high cholesterol, which eventually may or will lead to hypertension or more life-threatening issues where, unfortunately, it's at the end that we find out that this person was living with this disease.
Okay, we'll talk about management briefly, because I know that when someone is living with hypertension or diabetes, management is very key. But for now, this initiative is going on, and you're expecting that in all of the 36 states plus the FCT, people will turn out at the various centers to go and get their blood pressure and their diabetes checked. After this, which is going to end on the 10th of November, right? What would you say to the people about regular checks, outside of, this initiative?
So, when we say hypertension is a very treatable disease, it means that follow your doctor's orders. comply with what they have told you. I am glad to say not everyone will need medication. It could just be a lifestyle modification. Reduce alcohol, reduce your salt intake, exercise more regularly, and in every clinic, every doctor knows how often to ask your patient to come back for follow-up. Life is even easier now. Technology has advanced in medicine. You can have your own private blood pressure monitor at home where you check your blood pressure weekly, monthly, daily, depending on your doctor's instructions. So what is important is not only diagnosis and taking medication, continuous follow-up, continuous awareness. Read, Google is your friend, on how to control your numbers is very important. And that is the essence of this project. Not only know your numbers, but in controlling them.
Okay, I wanted you to also stress the fact that, you know, the management is something that should be done within the hospital setting, particularly discussing with your doctor, because sometimes there's a whole lot of advice as to how people can go ahead and manage hypertension or diabetes.
Now, well, we live in a society where advice from pastors, parents, friends can be confusing. What you have just said, Yomi, is the key. Adhere to your doctor's advice, your healthcare giver's advice. It doesn't even have to be a doctor. A well-trained nurse can give you advice. And the advice I will give now on the screen to non-patients is just take your medication as prescribed. Don't prescribe for yourself. Don't increase your dose because you check your blood pressure at home, or a nurse checks, or somebody randomly checks, and it is suddenly high, and you decide to increase your dose. Or it is suddenly low, and you believe that you have been cured of hypertension. Hypertension is a disease that I wouldn't say is a lifetime commitment, but it is a disease that once your blood pressure goes high, you need advice from a certified professional to control this number till the end of your lifespan. And I say again, it has been found out that some traditional remedies help. A lot of our chemical medications, aspirin for example, is made from the bark of just the iroko tree. But then, when we take traditional medicine with no dosage, not knowing the contraindicatory factors, meaning that if you are taking this medicine, do not do this, do not do that, it doesn't really do much help. Your primary caregiver is the healthcare experts, doctors and nurses. So please, please, in addition to taking garlic and hibiscus and all sorts of leaves, see your doctor and monitor your blood pressure.
Thank you.
So we can control it.
Thank you so much, Dr. Dolapo Fashawe. She is the Mandate Secretary, Health Services and Environment Secretariat in the Federal Capital Territory. Thank you for your time on the show this morning and for the enlightenment. We wish you all the best. And
thank you.
Okay. Sunrise will be back in a moment. Please stay with us.